Hi, I'm Holly Tanner with the Herman and Wallace Pelvic Rehab Institute, and I'm here with Stacey Futterman Tauriello, who has been a longtime friend and instructor, faculty member. And it really was through all of this pelvic rehab stuff that she and I became such good friends. So I wanted to give her an opportunity to tell you a little bit about herself. Stacey, can you tell us a little bit about your background as a rehab clinician?
Thank you, Holly, for asking me to do this interview. I graduated in 1996 from Nova Southeastern University, thinking I would work in a hospital because I loved hospitals. And that lasted a whopping little over a year in inpatient orthopedics. And then I went to outpatient orthopedics. But while I was in the hospital, a physician wanted someone in the hospital to get trained in biofeedback. And the only reason I went to take a class was because they paid for travel.
Yeah,
And that
why
is
not?
the honest truth. So back then, we didn't have computers. Remember Windows 95, right? This was like 1996, 97. You looked at the back of your advanced magazine, and there was a women's health class that was being given in Baton Rouge, Louisiana. And Baton Rouge, Louisiana is where I went. And I went to Baton Rouge, which was a women's hospital that only serviced women. And after I saw how they were treated after they gave birth, they went down to the physical therapy unit where, like, they did whirlpool baths and taught them exercises and watched their mechanics. And Holly Herman was actually my instructor for that class. And we did our evals on the floor on mats. I mean, that's how it
Wow.
was back in the day. So that all evolved in becoming an orthopedic clinician, a clinician that specialized in orthopedics, outpatient, as well as a pelvic floor specialty. So I moved to Chicago a few years after that from South Florida, and I really honed in on my skill set and learned so much from amazing clinicians there. And I got into lab assisting, and I just loved every aspect of it. Always keeping a balance with my patient load was always orthopedics as well as pelvic floor. And after that, I moved to back to the East Coast where I grew up and started in New York City and really honed in on my pelvic specialty. And in 2011, about 10 years ago, opened up my own practice, which is now celebrating its 10-year anniversary. And through that time, I lab assisted. And back in 2000, and Holly, what was it, 2007?
6, I think.
Six, you and I did a, what, 30-minute? No, it was a 2-hour
I
presentation.
think
Was
it
it
was
2 hours?
3 hour, 2 or
At
3 hours.
ASM on male pelvic pain. And that's how you and I met. Literally, we didn't even have Zoom. I mean, we were on the phone, on speakerphone, figuring out presentation, and we didn't meet until the day we presented. And then we were asked to become instructors by Holly Herman and Kathy Wallace that were starting up their own business. And that's how it all started.
Well, tell us a little bit more about what you're doing now.
So now, I mean, I think it looks a lot different just because of COVID. I gave birth personally in 2017, and a lot of my balance shifted in terms of my career. And I'm really right now was working on for the last 2 years saving a business. New York City is still in a bit of turmoil, and I did it. Like, this was like kind of the month that I was like, all right, we did it. We saved it. Opened up another practice in New Jersey, which is where I mostly work out of. So really focusing on keeping stability and balance, work-life balance in the business. And then also we've done a lot recently in regards to online teaching. So that's also an adjustment for us as instructors, really getting good. I mean, we went from traveling all around the world pretty much to teach. Now we're teaching virtually with lab classes. So getting really good at that, doing that 3 or 4 times a year. This weekend, I actually was part of the HIP certification for Hospital for Special Surgery. So that was actually a nice accomplishment. I both was took it as well as was one of the instructors for the pelvic floor aspect of teaching orthopedic musculoskeletal therapists about pelvic floor and its relationship to the hip. So that was really fun.
And you've always loved the hips relationship to the
Love it.
pelvis and
Love
and
it.
even participated in some research with Dr. Deborah
Hmm.
Cody
Yeah.
years ago. How did that research, if you want to just tell us briefly what the idea was with that research, how did it inform what was happening in the clinic and some of the explanations we had for hip pathology with pelvic pain, and how has that shifted a little bit? Because sometimes, we discover things, or we have results, we
Hmm.
have data, and then you step back and you look at that in the big picture, you try some things differently, but it evolves.
Right. So that research evolved from seeing the comorbidities that were happening in patients with vulvar pain. So we found that all these young patients, all of them had also hip dysfunction. That specific research related to patients that actually went on to have hip surgery and to see what they were like now 3 years later. What we've learned, even so, I taught that class. Last time I taught the hip certification was 2012. So we're going back 9 years ago. We did the research in 2014, 2015. So much has changed in terms of how physical therapists from a musculoskeletal perspective are treating hip pathology. They're not rushing to surgery, perhaps. Again, they have to make sure that the surgery is warranted and they'll have a good outcome. They're also learning too that like age matters. There's certain aspects of what they need matters. And I think, looking at that, I think the research was a stepping stone in putting hip pathology on the map with pelvic floor dysfunction. It just
Mhm.
put it out there that we as clinicians, whether we're coming into this, I know Herman and Wallace, you don't necessarily have to be a physical therapist to take our classes, but you have to have an understanding of the musculoskeletal system, and you cannot treat one without the other. Right.
Mhm.
So we used to have all these when I was doing the PowerPoint, it was all about teaching pelvic health specialists about how to scan for the hip. Well, now I was presenting to musculoskeletal therapists. And so it had to shift now and saying, okay, you're doing the hip scan. Now you have to ask the right questions and figure out, do they need a pelvic floor exam? Is this something that you're starting to treat them and they're not improving because they have an underlying pelvic condition?
Mhm.
Pelvic floor condition. So that was really neat. So it was really from both sides. And so yeah, it was great. And again, to be a part of, hospital special surgery is a very well respected institution here in New York and around the country. It's very well respected. So to be part of that was really, I think, an honor that they trust me in terms of sharing that information.
Right. And, a lot of participants are working with folks who do have hip labral tears. It might be known that it's mild versus
Mhm.
pretty significant. A lot of folks are, a lot of our participants are working with folks who've had labral repairs. And there's a lot of patients out there who you're really trying to weigh that decision of, do they truly need a repair and rehab after? What have you learned about even the post labral repair rehab in and of itself? Because one thing I would say is, it's a slow game, and
Mhm.
and we have to be patient with not just the tissues, but unlearning some habits or rehabilitating strength. What would you say to folks who are really trying to figure out, is there a clinical pearl or two that you have found with the labral repairs?
Well, I think it's working with your knowledge of strengthening and how well it is. And it's okay to be able to share a patient, right? If you're a pelvic health specialist and your knowledge about maybe higher level strengthening isn't up to par, one of the biggest things they said that always stuck out is return to sport. Whether it be they want to get back on a Peloton bike or they want to get back to skiing or they want to get back to tennis, return to sport has to be discussed day one. And that's for the mental aspect too. So, and then it's also like figuring out what that path is. And it's okay that it's slow, but the patient needs to understand that they're going to progress in a fashion to get them stronger and more stable. We always have to have stability before we have mobility, right? Like it's just that's just what we learned from a physical therapy perspective. So, yeah, and you need that background knowledge of getting them stronger without flaring up their pelvic floor symptoms. So
Yeah.
you have to kind of release and restore so that, and I always say when I teach, you've got to understand the why component. Why are they having so much pain? What can you do to strengthen without flaring? And I think that's huge.
And you mentioned that you were really impressed with some of the exercise approaches. And when you've been in any profession for a long time, it's really exciting to be excited about
Mhm.
information that you're hearing. So, can you share an example of what was kind of interesting or that got you excited?
Well, the first thing that got me excited is I realized I was doing a lot of things right. So that actually helped.
Yay!
And then they shared a lot. One of the biggest takeaways, I always like walk away with a class like, oh, I just glad I showed up because now I can try this, was the neuromuscular reeducation portion of the exercise. So they were doing like opposite arm, opposite leg lifts in all fours, right? Something is like protocol to us. But what she added was task specific. So keeping the leg out and moving the cones, like
Mhm.
having your brain, like it was that like intense task specific brain re-education. And she did that with almost like every exercise she shared with. That was really cool.
Mhm.
That was like one of those game changers of like, I often think of neuro as Parkinson's, right? So a Parkinson's patient, if you want them to walk and lift their leg, right? Because they're shuffling, you would put something in front of them and say step over it, right?
Mhm.
Task specific. Well, you don't, obviously our patients aren't in that disarray from their nervous system, but re-educating the nervous system so it's not just a lift. It's like they're actually doing something that becomes functional. So
Mhm.
I
Yeah.
liked it.
This is a personal question, so you share whatever you're comfortable with. Were you surprised having a baby a few years ago that as much as you knew all of the patient advice you've given, all of the ability to really sort out through the puzzle pieces, to know what you were getting into, so to speak, were you still surprised at just how challenging it can be?
Oh my God. So in 2019, a Today Show director left a message on my website. And she's like, I'm trying to get in touch with you. We want to do it. We want to air for the Today Show online. So, I also recommend to everyone if they ever get these like weird things that look like spam, call because you never know what can happen. Well, it wound up being a Today Show director and producer, and they were doing a motherhood series. And I contacted her and she's like, listen, she's like, I heard great things about you. Can you get a patient to come in and be our person? I said, I have a patient. It's me. I said, I'm 14 months postpartum. I said, I have issues. I had issues. I've learned so much. I will be your patient as well as the person that can at least go through everything. She's like, let's do it. Let's just do it. So I did it and it was incredible. And we loved the air and we were picked up by the Today Show itself. And what I shared with them on this is that you know, the process of getting pregnant, I was in my 40s, so I was older mom, being pregnant, having some issues during pregnancy, and then the actual delivery process was it's not great to be a pelvic floor physical therapist trying to push a baby out of your vagina. It's just not really good. Thinking that my uterus and everything was just going to come flying out with it and like we'd have to clean up the pieces. But you have to go through it. And then you realize too, like your postpartum experience is all about healing. And that as much as it's easy for somebody that's 21 to give birth and bounce back really easily. A lot of the women that are coming or having babies right now are in their 30s and 40s, and their bodies don't respond the same, especially now during COVID. It's a game changer right now. Things are different. And yeah, I mean, I had incontinence after I gave birth. I still struggle. My body within COVID from not exercising and going to the gym and everything still takes a toll. And yeah, I mean, and I feel like it made me more empathetic to some
Mm.
of my pregnant patients, being able to have that conversation of, healing and understanding their body and expectations and all of that.
Mhm.
So, yeah.
You and I have had the great fortune to have Holly Herman and Kathy Wallace, the co-founders of the institute, as instructors. Is there a clinical pearl or a fun phrase that always comes to mind for you when you think of either of them, or just characteristics, highlights of their teaching that you remember?
It's funny. When I was teaching this hip class, I decided I wanted to name drop, very typical for New York. You want to really show who you are. And I sent a message to Holly Herman, literally, and I haven't spoken to her in about 6 or 8 months. She's a grandma now. So great. Anyway, so I sent her a message asking her, and I also sent a message to Diane Lee to ask if I could put a picture of the both of them on this presentation, again, to musculoskeletal, physical therapists, where I feel like the two merge, like the two people that I've looked up to in my career. And, they both accepted and said yes. And it was a picture of the two of them. Holly had so much knowledge and so much ability to connect with a patient. And Kathy did too. So Kathy actually came and stayed at my house right before COVID and helped teach a class to my practice. And I'm trying to think of like the certain things that like stand out about them. One of my big phrases actually doesn't come from each of them. It comes from Pam Downey, and that is healthy tissue doesn't hurt. I think I say that at like every class and to every patient. It's one of my biggest clinical pearls that come, and it didn't come from Holly Herman or Kathy Wallace.
Well, we have been really fortunate that we've been able to learn from pioneers in the field like Diane, Kathy, Holly, Dawn, and that list goes on, doesn't it?
Mm.
What are you looking forward to? I certainly know that I'm starting to miss teaching with other instructors and doing some of the
Mm.
traveling, although we certainly have made the most of what we can with the Zoom teaching. Is there something you're looking forward to getting back to, or is there a funny story you feel like sharing about all of your teaching experiences that that still makes you chuckle?
Well, my teaching experiences. I mean, you and I know we've showed up to places where we were like, okay, let's do this. But I would love to get back to teaching, even though I do have a 3.5-year-old right now. It's actually a blessing that I get to teach from my living room or from my office that's 5 minutes down the road. And I don't feel as fatigued and tired. For all of you that don't realize, we go out and we teach for 3 days, we're gone for 4, and we are still work full time, have full time families. Like we have so much and then give so much during these classes. But I would like to get back to that. I would like to get back to going to a conference again and networking, and that is the one, I think, big thing that I miss, and hearing people present. I know that like the International Pelvic Pain Society is meeting this month or next month. I chose not to go just in terms of logistics
Mhm.
and COVID and stuff. And we're in a mask all day and then being in a mask all
But you
weekend
would
is
highly
tough.
recommend that folks do go to those conferences, right? I mean, again, the
Absolutely.
social
Absolutely.
connections, the things you learn from a multidisciplinary environment.
Totally. 100%. Yep.
Yeah.
Absolutely. Absolutely. And then for those, it doesn't matter what discipline you are, right?
Mhm.
So for us to attend physical therapy conferences, obviously you have to be a physical therapist, but International Pelvic Pain Society meeting,
Mhm.
ISHWISH, other conferences, it doesn't matter what discipline you are, I think
Mhm.
is really, really important.
Well, then, other than the hip dysfunction, which you've talked about and that you love teaching about, is there another topic that you think is really fun?
Obviously, pregnancy and postpartum, which we've already discussed. Dyspareunia or painful intercourse is probably one of my favorite things to treat and so treatable. And I'm actually passionate now about finding new products for patients. So this is one of my like loves. Intimate Rose is now my new favorite product. Love that it was developed by a physical therapist who
Mhm.
does pelvic health.
Just like the ONUT.
And
Mhm.
yeah, so that's definitely fun. And I think for me, I think really getting involved in strengthening my own body and then now really getting back to patients getting back in the gym and really getting themselves as fit as possible,
Mm.
whether they suffer from pelvic pain or incontinence, I think is like my newfound passion. I really want that's one of my goals for the
Mhm.
next, whether it be to get a Pilates certification, get a yoga certification, or just start to test out as many strengthening programs as I can. That's my
Yep.
goal.
It keeps you fresh, keeps you searching
It
for
does
new ways to stretch your brain and be more
stretch your own
well-rounded.
body.
Totally.
Yeah. Yeah.
Well, Stacey, thank you so much for all your years of contributions to the Institute. And there's so many people out there who've had you as an instructor, and I'm sure enjoy your enthusiasm and humor just as much as I do. Looking forward to, again, more teaching. And thanks so much for sharing some of your insights and thoughts.
You're welcome.